Flurbiprofen is a nonsteroidal anti-inflammatory drug and SAID with analgesic and anti-inflammatory properties. Its pharmacology includes 1. Mechanism of action. Flurbiprofen works by inhibiting cyclooxygenase COX enzymes, particularly COX1 and COX2. This inhibition reduces the production of prostaglandins, which are responsible for pain, inflammation, and fever. 2. Anti-inflammatory. Flurbiprofen reduces inflammation by decreasing the release of inflammatory mediators like prostaglandins. 3. Analgesic. It provides pain relief by blocking the perception of pain signals in the central nervous system. 4. Antipyretic. Flurbiprofen can lower fever by reducing the production of prostaglandins in response to pyrogenic fever-inducing stimuli. 5. Pharmacokinetics. It is typically administered orally, and its absorption is influenced by food. Flurbiprofen is metabolized in the liver and eliminated through urine and feces. Pain and inflammation. For adults, the typical starting dose is often 100 to 200 milligrams taken orally, 2 to 3 times a day. Osteoarthritis and rheumatoid arthritis. The dosage for arthritis conditions may be higher, often starting with 200 milligrams taken orally, 2 to 3 times a day. Dysmenorrhea menstrual pain. The typical dosage is 50 to 100 milligrams taken orally every 4 to 6 hours, as needed, starting at the onset of menstrual pain. Flurbiprofen, like other nonsteroidal anti-inflammatory drugs, NSAIDs, can have various side effects. Some of the common side effects associated with flurbiprofen use include 1. Gastrointestinal issues. These are among the most common side effects and may include stomach pain, indigestion, heartburn, nausea, vomiting, diarrhea, and in some cases, gastrointestinal bleeding or ulcers. 2. Headache. Some individuals may experience headaches as a side effect of flurbiprofen. 3. Dizziness. Flurbiprofen can sometimes cause dizziness or lightheadedness. 4. Skin reactions. Rarely, skin rashes or itching may occur as a side effect. 5. Fluid retention. NSAIDs like flurbiprofen can lead to fluid retention, which might result in swelling, particularly in the legs and ankles. 6. Hypertension. Flurbiprofen can increase blood pressure in some individuals. 7. Kidney effects. NSAIDs, including flurbiprofen, can affect kidney function in some cases, leading to changes in urine output or color. It's essential to stay hydrated while taking this medication. 8. Cardiovascular risk. There is a potential increased risk of cardiovascular events, such as heart attack or stroke, especially in individuals with pre-existing cardiovascular conditions. 9. Gastrointestinal bleeding and ulcers. Although less common, NSAIDs like flurbiprofen can increase the risk of gastrointestinal bleeding or ulcer formation, which can be serious. 10. Allergic reactions. Some people may experience allergic reactions to flurbiprofen, which can manifest as hives, difficulty breathing, swelling of the face, lips, tongue, or throat. Seek immediate medical attention if you experience these symptoms. Flurbiprofen, like other nonsteroidal anti-inflammatory drugs, NSAIDs, can interact with various medications and substances. Some of the most common interactions and medications to be cautious of when using flurbiprofen include 1. Other NSAIDs. Concurrent use of multiple NSAIDs, including flurbiprofen, can increase the risk of gastrointestinal bleeding and ulcers. It's generally recommended to avoid using more than one NSAID at a time unless specifically instructed by a healthcare provider. 2. Anticoagulants and antiplatelet drugs. Flurbiprofen can enhance the antiplatelet effects of drugs like aspirin, clopidogrel, or warfarin, potentially increasing the risk of bleeding. If you are taking blood-thinning medications, discuss the use of flurbiprofen with your healthcare provider. 3. Corticosteroids. Combining flurbiprofen with corticosteroids can increase the risk of gastrointestinal ulcers and Bleeding, close monitoring is necessary if these medications are used together. 4. Selective serotonin reuptake inhibitors SSRIs and serotonin norepinephrine reuptake inhibitors SNRIs. Combining NSAIDs like flurbiprofen with these antidepressant medications can increase the risk of bleeding, especially in the gastrointestinal tract. 5. Angiotensin-converting enzyme ACE inhibitors and diuretics. Flurbiprofen may reduce the antihypertensive effects of ACE inhibitors and diuretics, potentially leading to increased blood pressure. 6. Methotrexate. Flurbiprofen can increase the levels of methotrexate in the blood, which may lead to methotrexate toxicity. This combination should be carefully managed by a healthcare provider. 7. Lithium. NSAIDs like flurbiprofen can increase lithium levels in the blood, potentially leading to lithium toxicity. Close monitoring is necessary if these medications are used together. 8. Alcohol. Consuming alcohol while taking flurbiprofen can increase the risk of gastrointestinal irritation and bleeding. 9. Certain antihypertensive medications. Flurbiprofen can reduce the effectiveness of some antihypertensive medications. Consult with your healthcare provider if you are taking medications to control blood pressure. 10. Other medications. Always inform your healthcare provider about all the medications, supplements, or herbal products you are taking, as they can potentially interact with flurbiprofen. Flurbiprofen is considered to be more potent than ibuprofen, meaning it may require a lower dose to achieve the same pain-relieving effects. Flurbiprofen typically has a longer duration of action compared to ibuprofen, so it may be taken less frequently throughout the day. Ibuprofen is commonly used for a wide range of pain and inflammation, including headaches, muscle aches, and arthritis. Flurbiprofen may be prescribed for conditions like rheumatoid arthritis and certain eye conditions,